Welcome to Mastering Section C Cognitive Patterns on the MDS assessment. In this video, we'll help you identify the various components of Section C, understand the coding instructions, accurately assess cognitive patterns, prevent common coding errors and misconceptions, and recognize the impact of Section C on care planning and how you can support the resident and facility. The intention behind this section is to determine the resident's attention, orientation, and ability to register and recall information, and to identify if the resident has signs and symptoms of delirium. Items included in this section will involve conducting a brief interview or staff assessment for mental status, and assessing for the various signs and symptoms of delirium. In this section, we begin with item C0100, where we are asked if a brief interview for mental status be conducted. Here, we will be simply determining if the resident is rarely or never understood, which is typically limited to residents that are not able to communicate verbally, in writing, or by using any other method. If the resident is at least sometimes understood verbally, in writing, or using another method, an attempt to interview the resident should be performed. If not, skip to item C0600 to complete the staff assessment for mental status. In our interview, each item in C0200 through C0400 should be performed in one sitting and in the order provided. If the resident chooses not to answer a particular item, accept their refusal and move on to the next questions. Refusals will be coded as incorrect, no answer, or could not recall in this item set. Before we begin, let's review a few basic instructions for conducting our interview. If possible, conduct the interview in a private setting. Be sure the resident can hear you. Sit so that the resident can see your face and minimize glare by directing light sources away from the resident's face. Give an introduction before starting the interview. Utilize the resident's preferred language, communication devices, or hearing aids if applicable. We'll begin the interview by starting with the repetition of 3 words, captured in item C0200. Interviewers will need to use the words and related category cues as indicated. Here you can say to the resident, "I am going to say 3 words for you to remember. Please repeat the words after I have said all 3. The words are sock, blue, and bed. Now please tell me the 3 words and record the number of words correctly repeated after the first attempt." If the resident could not recall all 3 words, repeat the words along with their corresponding cue category for purposes used later in this interview. If the resident still does not recall all 3 words correctly, you may repeat the words and category cues up to 2 more times. If the resident does not repeat all 3 words after 3 attempts, reassess ability to hear and make any necessary accommodations. If the resident can hear, you can now record the maximum number of words that the resident correctly repeated on the first attempt. This will be any number between 0 and 3. Following will be item set C0300, temporal orientation. Here we will ask the resident each of the following questions separately. Please tell me what year it is right now. What month are we in right now? And what day of the week is today? Allow the resident up to 30 seconds for each answer, and do not provide clues. If the resident specifically asks for clues, respond by saying, "I need to know if you can answer this question without any help from me." It's important to know what responses, or a lack thereof, would constitute the interview to end early. If all responses up to this point have either been nonsensical, there has been no verbal or written response to any of the questions up to this point, or a combination of the two, you may end the interview after C0300 day of the week and -C0400A through C. Code 99 in the BMS summary score, and proceed to the staff assessment for mental status. Alternatively, if all responses up until this point are coded 0 because answers are incorrect, continue the interview. To conclude our interview, we'll be revisiting the first 3 words we began with to answer item C0400 recall. Here you will ask the resident the following. Let's go back to an earlier question. What were those 3 words that I asked you to repeat? Allow up to 5 seconds for spontaneous recall of each word. For any word that is not correctly recalled after 5 seconds, provide a category cue. Category cues should be used only after the resident is unable to recall 1 or more of the 3 words. Allow up to 5 seconds after category cueing for each missed word to be recalled. Now you may add up the values for all questions from C0200 through C0400 to obtain your BMS summary score for item C0500. Certain instances will require a BMS summary code to be overwritten to 99, unable to complete interview. For the BMS to be considered as incomplete, a resident must choose not to answer or must give completely unrelated, nonsensical responses to 4 or more items, and a staff assessment for mental status should be conducted. Similar to our resident interview, the staff assessment will involve evaluations to gauge short-term and long-term memory. The short-term memory domain can be measured by asking the resident to describe an event 5 minutes after it occurred, if it can be validated, or follow through on a direction given 5 minutes earlier. If the most representative level of function shows the absence of recall after 5 minutes. Code 1, for memory problem. Long-term memory status can be measured by engaging in conversation, reviewing memorabilia such as photographs, memory books, or observing their response to family who visit. Ask questions for which you can validate the answers from review of the medical record, general knowledge, the resident's family, and others, such as, are you married? What is your spouse's name? Do you have any children? How many? When is your birthday? If the resident did not recall long past information or did not recall it correctly, code 1, for memory problem. Next, we'll review item C0900, memory and recallability, which will involve asking the resident about a series of items, such as, what is the current season? Is it fall, winter, spring, or summer? What is the name of this place? If the resident is not in their room, ask, will you show me to your room? And observe the resident's ability to find the way and mark off each item accurately recalled. For residents with limited communication skills, in order to determine the most representative level of function for the preceding questions, ask direct care staff across all shifts, family, or significant others about recallability. Also, you can review the medical record for indications of the resident's recall of these subjects during the look-back period. Lastly, in item C1000, cognitive skills for daily decision-making, we'll be recording the resident's performance in making everyday decisions about tasks or activities of daily living. In this particular item, it is important to focus on whether or not the resident is actively making these decisions and not whether staff believes the resident might be capable of doing so. If a staff member takes decision-making responsibility away from the resident regarding tasks of everyday living, or the resident does not participate in decision-making, regardless of what the level of capability may be, the resident should be coded as impaired performance in decision-making. In this section, we'll review item C1310, signs and symptoms of delirium. Delirium is a mental disturbance characterized by new or acutely worsening confusion, disordered expression of thoughts, change in level of consciousness, or hallucinations. To assess, we'll observe the resident's behavior during the BIMS for the signs and symptoms of delirium. If the staff assessment for mental status was completed instead of the BIMS, ask staff members who conducted the interview about their observations of signs and symptoms of delirium. Review medical record documentation to determine the resident's baseline status, fluctuations in behavior, and behaviors that might have occurred during the 7-day look-back period that were not observed during the BIMS. Item C1310A through D. Proceed to list the most common signs and symptoms of delirium and allow us to document the presence and frequency of those specific behaviors such as acute mental status change, inattention, disorganized thinking, and altered level of consciousness. When completing Section C, avoid common coding errors, such as not documenting refusal as 99 if the resident refuses or cannot complete the interview, conducting the interview too quickly, or rephrasing questions in a way that changes the intent. Residents that exercise their right to decline treatment should not be captured as impaired decision-making in item C1000, cognitive skills for daily decision-making, and confusing delirium with dementia. Dementia is chronic, delirium is sudden or acute. Section C plays a pivotal role in the resident's care, which is why coding accuracy is imperative. For more information about coding the MDS, or to see more MDS-related content, follow our channel at MDS Made Easy. Brought to you by the Data Nurse, your partners in MDS Precision.